Hi, my name is Dee Dee Love, and this presentation is about using music in the prevention and treatment of delirium. I decided to research this project because not only am I a nurse, but I'm also a musician, and I've seen firsthand the positive impact that music can have on patients. I wanted to see if there was any evidence-based research to support this, and it turns out that there's quite a bit. The Peacock question that I used was, in medical surgical patients with suspected delirium, how does music applied during nursing interventions compared to no music affect mental status assessed using the confusion assessment method, or the CAM method, within 36 hours? So what is delirium? It's an acute stage of confusion. Acute versus chronic. Chronic would be dementia. You need to understand your patient's baseline mental status in order to assess an acute stage of confusion. It's often short-term and reversible. Can be hypoactive, hyperactive, or both. We'll discuss this more further in the presentation. It's common among older adults in unfamiliar settings. Older adults, those 65 and older, we'll be discussing today, and unfamiliar settings, that's any acute care facility. So some facts about delirium. It affects 80% of intensive care patients and 50% of hospitalized older adults. That's staggering, considering that oftentimes it goes undetected. It's probably even higher. Costs between $4 and $6 billion annually. That's an enormous amount, and it's probably on the low side because it's often undetected. It's associated with increased hospitalization, long-term impairment, and yes, mortality. Delirium kills our patients, and it often goes undetected and untreated. So we don't even really know the true effects of delirium at this point. There are several risk factors for delirium. We're going to focus on the top 4 for this presentation. The first one being increased age. We're using 65 and older, but it can happen with younger patients. Comorbidities, again, younger patients, if they have a lot of diagnoses, then they're at risk, and we need to assess for delirium with those patients. Immobility doesn't just mean they're completely immobile, it can be a change in mobility for them. And infection, that's most of our patients. We're going to use the confusion assessment method to assess for delirium in this presentation. It's what we use at my facility. I've often found that even the nurses at my own facility have expressed that they need more training in this tool. And so I also needed it, so I did some research. The first 2 things that we're looking for with the CAM method is acute onset. Again, you need to know your patient's baseline, and inattention. What is inattention? Inattention is the ability or the inability to focus on conversation. Again, this would be acute, so it would be a change in your patient's ability to focus. And are they easily distracted? Are they able to focus at all? And remember the baseline with us. If they have both of those, you can go farther. Now we're looking for either disorganized thinking or an altered level of consciousness. Disorganized thinking, incoherent rambling, illogical flow of ideas. They may not make any sense at all, or they might be making some sense and then moments of not. So if they have disorganized thinking and they have the other 2, they're experiencing delirium. If they don't have disorganized thinking, do they have an altered level of consciousness? This is where the hypoactive and the hyperactive come into play. Hyperactive is, it can be combative or violent, or it could just be they're super stimulated by sound and light, something very noticeable. Hypoactive could be as extreme as catatonic, or they may just be extremely lethargic and difficult to arouse. If they have either one of those and they have acute onset and inattention, they are experiencing delirium. So why is CAM important? It helps us differentiate between dementia and delirium, which is a major problem. Delirium is often mistaken for dementia. Again, knowing the baseline can help prevent this. And it's part of any proper older adult assessment. If your patient's 65 and older, you need to go ahead and do a CAM assessment on them. So musical interventions. This is where the research project got interesting for me. There were 2 different studies, one by Chong and Associates and one by McCaffrey and Associates, that used music as interventions, and it really helped the patients. Chong and Associates discovered that it improved patients' compliance mood and cooperation, and it even can elicit memory recall. McCaffrey and associates noticed a significant difference between the experimental group and the control group. Those in the experimental group had fewer episodes of confusion and delirium, and their readiness to ambulate scores were higher, so the patients healed quicker and were able to leave the hospital sooner. This has a big effect on our cost. So the interventions that they used, they played the music during nursing interventions. They tried to do it for at least 2 hours a day, but more if the patients wanted it. They taught family members how to play the music for them, so the patients or the family members or the nurses could be playing music. You all need the proper equipment. You need a CD player, an iPod, something to play the music on. Invite volunteer musicians to play for the patient. Does your hospital have a volunteer department that can handle this? There are also volunteer musicians in the Jacksonville area that will come to your facility. I know because I was one. And also consulting a music therapist was another one of the things that they did. A licensed music therapist. Does your hospital have one? I know that Wilson Children's Hospital has one full-time on staff, and I think it might benefit all hospitals to have one. I also did I did a review of guidelines. I used a review of guidelines in my paper, and it was by the American Geriatric Society, and there were several best practices in it as well. But between the three papers that I researched, the best practices that we came up with were playing music of patient's choice. This was very important. It took something familiar in an unfamiliar environment. It was comforting to the patient. It was imperative that they played the music of the patient's choice, not just turning the radio on or turning the music channel on at night. It was the patient's choice of music. They utilized a licensed music therapist. Again, this would be very beneficial to any facility. And utilizing a multi-component, non-pharmacological intervention program. Does your facility have one? I don't believe that mine does. I've done research and found that I can't seem to find one. I think it'd be a great idea for any facility. I'm also going to play a video clip for you. It went viral recently. It's a excerpt from a movie called Alive Inside. You can get the full movie reference in my reference list at the end of this presentation.
Hi, Papa. Hi, Papa.
Huh?
How you doing?
I'm all right. I'm fine. Wait.
Who am I?
I don't know. Wait a minute. I don't know.
Okay, it's Cherry. How long has he been in the nursing home? Approximately 10 years. He was having seizures, and my mother couldn't handle him at home. Of course, it affected me greatly because he was always, fun-loving, singing, every occasion he would come out with a song, no matter where he was. I remember as a child, he used to walk us down the street, me and my brother, and he would stop and do Singing in the Rain. He would have us jumping and swinging around poles. He was, he was good. He was always into music, always loved singing, dancing.
His name is Henry Dreyer.
Uh-huh.
And I'm looking more or less for religious music for him.
Okay.
Because he enjoys music and he always quoting the Bible. So I'd rather have that for him.
We first see Henry inert, maybe depressed, unresponsive, and almost unalive.
Henry.
Yeah?
Henry.
Yes, sir.
I found your music. You want your music now?
What do you want me?
Let's try your music, okay? And then you tell me if it's too loud or not.
Then he is given an iPod containing, we know, his favorite music. And immediately he lights up. His face assumes expression, his eyes open wide. He starts to sing and to rock and to move his arms, and he's being animated by the music.
And and he used to always sit on the unit with his head like this. He didn't really talk to much people. And then when I introduced the music to him, this is his reaction ever since.
The philosopher Kant once called music the quickening art, and Henry is being quickened, he's being brought to life.
Yeah.
I'm going to take the music for 1 second, okay? Just to ask you a few questions. Okay? I'm going to give it back to you.
Uh-huh.
Okay.
The effect of this doesn't stop, because when the headphones are taken off, Henry, normally mute and virtually unable to answer the simplest yes or no questions, is quite voluble.
Henry,
Yeah.
do you like the iPod? Do you like the music you're hearing?
Yes.
Tell me about your music.
Well, I don't have one, I mean.
Do you like music?
Yeah, I'm crazy about music. You play beautiful music, beautiful sound. Beautiful.
Did you play music when you were did you like music when you were young?
Yes, I went to big dances and things.
What was your favorite music when you were young?
Well, I guess, well, Cab Calloway was my #1 band guy. I like it.
What's your favorite Cab Calloway song?
Oh, I'll be home there for Christmas. Oh, you can count and plan on me with plenty of snow, mistletoe, present wrapped around your tree. Ow!
So in some sense, Henry is restored to himself. He has remembered who he is, and he's reacquired his identity for a while through the power of music.
What does music do to you?
It give me the feeling of love. No man. Figure right now the world need to come into music, singing. You got beautiful music here. Beautiful, oh, lovely. And I feel the band of love, the dream. The Lord came to me, made me holy. I'm a holy man. So he gave me this sound. I'll just say, I meet you. Let me see. Rosalie, won't you love me? Rosalie, won't you be sweet and kind?
With this beautiful new technology, you can have all the music which is significant for you in something as big as a matchbox or whatever. And I think this may be very, very important in helping to animate, organize, and bring a sense of identity back to people who are out of it. Otherwise, music will bring them back into it, into their own personhood, their own memories, their own autobiographies.
So again, playing the music of a patient's choice was pretty powerful. So why should I consider music therapy? We don't always see the long-term effects of delirium. Our patients are, especially in the medical surgical unit, our patients are on the floor for, maybe maximum 2 weeks, and then they move on. So we don't often see the long-term effects that happen. And if music can help, it's a small, non-invasive step that can make a big difference. We can avoid the mortality risk, and the costs are staggering. We can save our facilities money, so why wouldn't we do it? In conclusion, we really want to make sure that we're reassessing our patient regularly. We reassess using the CAM method. If you notice a change in your patient, reassess them again. You can use the CAM multiple times throughout your shift. Document the interventions used. We want to make sure that if we're using music, that those patients we're using music with patients, so we want the doctors and facilities to know that we're using it. So document that. Document your results regularly. Documentation is important for future research, so please remember to document. I want to thank you for listening to my presentation, for taking the time out of your day, and I'd like to ask you to do one more thing for me. At the bottom of this page, you'll see a link for SurveyMonkey. It's 5 questions. Just take a few minutes to answer them for me. If you can't click on the link, copy paste it into your browser and just answer those questions. Thank you very much.